So a little update from today. I was supposed to start my chemo cycle 2 this morning. So what happens when you're going to be going through chemotherapy is, let's say you start on the Monday, which is my normal start date. On the Friday before, you get bloods taken and they run a number of pre-chemo checks on certain indicators that they can read from your blood. So your red blood cell count, your white blood cell count. They're tracking a cancer tumour metric that's for me, and you know there's dozens of other metrics that they check just as standard. And chemotherapy IV is very toxic, and it's essentially a poison. The drugs that I've been given, they target. It's not specific to cancer cells. They target fast-growing cells, of which cancer cells is one of those different types. But they also kill healthy cells like white blood cells. So they do this kind of pre-chemo blood check to make sure that your levels are high enough so that once you start the IV, that your body's going to be able to cope if anything else happens, like I picked up a cold or some sort of infection. So I've completed cycle 1, was all ready to go, had my bloods taken on Friday morning at my local GP, and the cancer centre ward 1 phoned me on Friday afternoon to let me know that my white blood cell count wasn't high enough to allow me to start IV on Monday. So they said, let's give it a couple of days. Hopefully you just needed a few more days without taking the chemotherapy tablets, because I only finished taking them on Monday night, and drugs stay in your system for a couple of days after you've taken them. So although I did detox, I did some food and liquid detox and stuff and some fasting last week, which helps get rid of the chemicals, and through time also boosts your white blood cell count. Obviously they were still too low on Friday, so I had to make a trip to the hospital on Sunday afternoon to get bloods taken again, through both arms, because one of the arms stopped working halfway through. Pin pushing should be my nickname right now. I'm a frequent flyer at my GP's, and I'm embarrassed because I've been to my GP more times in the last 3 months than I have in my whole life, no joke. Anyway, so I got my bloods taken on Sunday at 2 p.m. at the hospital, and they phoned at 7:45 this morning and said my white blood cell count has gone down further, not in the opposite direction which I wanted. So the plan for this week's completely changed, because I cleared my diary for the next 3 or 4 days. Didn't have much really to do because I'd left time to be out basically all day today. Tomorrow would have been a write-off, and probably most of Wednesday, and then that's when I usually start to feel slightly better and I can build, or at least attempt to get back to where I am normally. So to be perfectly honest, I'm a bit hacked off because I just want to get this bloody chemotherapy treatment done, and any delay to that just pushes the timelines out further, and I just want it over and done with so that I don't have to constantly be thinking about staying away from people who've got infection and socials getting cancelled because people have got a bug, and booking things around medical appointments and things. So it's just really frustrating. However, white blood cell count is really important. White blood cells help fight infection and bacteria, and if you get an infection or a disease, then they're the little knights in shining armour that come and fight off the disease and the infection and get rid of it. And if I'm going to be taking drugs that destroy them, or I'm taking drugs that are destroying them, then the rest week needs to be there to allow them to come back up again, because I can't have no white blood cells, because if I got an infection, my body wouldn't be able to fight it, and I would end up riddled with disease. So, you know, although I might feel okay, this is a message that at a cellular level, my body's not ready. It's not in a place where it can cope if I did get an infection. So I get it. I'm grateful, you know, that they're doing these checks, because it would be absolutely horrific if I was going through all of this treatment and then I picked up a common cold and I got absolutely floored with it for a month because my cells couldn't fight it because they didn't have the right components to it. So it's a message that I'm not ready at a cellular level, and actually your body's, it's really important for there to be balance and for it to be able to cope with things. And sometimes the signs that you get externally don't tell you everything that's going on internally. So although I feel okay and good some days at a cellular level, it's still not quite right. So I'm just resting today. Probably try and do a few wee things in the house, and then just chill. They basically said I need to wait 2 or 3 days for to be given a chance for them to come back up again naturally. I'm waiting on a call from the nurse to discuss more. So anyway, that's the update on that. Yeah, I'll let you know once I've started cycle 2.